You guys want to know what's in the call bag? Let's take a look in the call bag today. So, this is my ophthalmology call bag. For those of you guys who are new to the channel, I am a second-year ophthalmology resident. That's someone trained to be an eye surgeon, medical doctor, training to learn surgery on the eyes. So that's what I'm doing. This is the bag that I have perfected over many bags that I've tried, and way too much money involved basically into this. What this is for is for when I'm on call as a doctor going to see patients. This is what I use. It has everything I need in it, and I even use it as my everyday bag because it's super efficient, super compact. So you guys were asking me in some of the other videos what is in this bag. So today in this video, I'm gonna show you. Let's go. So these are the bags that I tried before I landed on the one that actually works for me. I tried these just regular backpacks, never could find things in it, they were getting lost, just a big single pocket. I tried these small little sling backpacks like this, it didn't work, they're too small. Then I started using these camera bags, and this is where I kind of found the secret to it because it's all compartmentalized. It has these little pockets where everything can go. Then I found this one, and this one was actually really good. It held everything that I needed for call, and then I just basically got a bigger version of it. And the reason for that is because I needed to fit one more thing in this bag that I wasn't using in that bag. Let's get into the call bag. Ophthalmology is a very regimented exam. It's a very specialized and specific eye exam that you do on essentially every patient. For the seeing the patient ever starts, I have this little notebook that I write down the consult in. And I do it like this. The number they call me, I write there, whoever's paging me essentially. This is where I put all the exam findings. I put a check mark once I write a note, once I do the follow-up, and then all the other details about the consult and about the patient. Draw a line under that patient, put a little check box when it's done. When I get tons of consults, I can keep it all organized. So I keep all that in that book. So once I'm actually in seeing the patient, first thing I do after talking to them is I check their vision. So I have these near cards to check vision. I have two. I don't know why. I only need one, but I have two. And then I have two pinhole occluders. Also, I only need one, but I have two for some reason in this bag. And so this simulates glasses. You put this down, patient looks through these little holes, and it gets rid of refractive error. The other thing I have in this front pocket is this light, which I did a video on. It's the best light that I've found for ophthalmology. And if you're just looking for a good, solid, sturdy pin light, this lumen top pin light is pretty good. Check out the other video I did on it. So this is something you can use for checking pupils. And then in this front pocket, I also keep ibuprofen because it is not infrequent that I get headaches on call. So I keep that with me. And then on the side, I keep the pager until I'm actually on call, then I wear it. But this is where I keep it most of the time. And then on this other side, we have Fig Newtons if we get hungry. That can vary, and then breath mints for in the clinic, seeing patients because we're right in people's faces, and sometimes we need to give them a breath mint. This is a good luck charm on the front. It doesn't work, but it's there. And then we get into the bag. It had straps on it that I cut off because they got in the way. They were little clip straps, and I cut those off. Oh, before we go inside, I do keep the badge in the front. That gets me in everywhere. I can't lose that. The best part about this bag is that I can go into the patient's room, set it down on the table, flip it over, open it, and then I have everything compartmentalized, and it's just laying open for me. I'm not digging through a bag looking for stuff. It's very organized like this. That's why I like this bag. The reason I got the bigger bag is so I could fit this in the center. This is my loupes. Loupes are just fancy glasses with magnifying lenses on them. These are just Nike glasses with these, which are magnifying glasses, which are 2.5 time magnification. So if I need to suture or stitch up someone's eyelid that's been completely just cut apart by whatever, these help a lot because it helps me see the fine detail and actually put the tarsus back together and suture it up. It's a lot easier than doing it without the loupes. At least it is in my opinion. I keep the loupes in the center. I don't have to use those very often, but it's nice to have them when you do need them for an eyelid laceration. That's what's in the center of the bag. Next is right here in this little pocket, and all these things are just little Velcro dividers that you can move around and customize, and that's why I like it, because I can make it however I want it to be. And so I just fit the lenses into this little slot, just slides in. It's very satisfying. The lenses, I have a 20 diopter for looking at the peripheral retina, a 90 that I can see through undilated pupils and see the macula with, and then I have the Super 66 lens, which is higher magnification for looking at the macula. And so those are my lenses. In this little compartment here I keep glasses cleaner and lens cleaner so I can clean off the lenses. I keep this to put my glasses in. I always wear glasses on call, and I never wear contact lenses because if I get stuck in the hospital and have to sleep there, I don't want to sleep in contact lenses and they get a corneal ulcer, which is ironically what I might already be in the ER for seeing. Also in this little compartment I have this box, which is the gonio box. Gonio lens inside. What a gonio lens is it's something that goes right up against the eyeball, touches the eyeball of the patient, and then on the side I see from, it has these mirrors and it lets me look into the angle of the eye, the drainage angle. So it's a nifty little tool. Also in my gonio box, I've taken an X-Acto knife and made another little slot here to hold this. So I made that little cutout, and then I have this scleral depressor. What a scleral depressor is something that freaks patients out a whole lot when you come at their eye with it. But what you do with it is you push on the edge of the eye, so when you're looking at the peripheral retina with your indirect ophthalmoscope and your 20 diopter lens, you push to bring the peripheral retina into your view so you can see peripheral tears, holes. You can use it to laser retinopexy things that are really far out, or to put PRP way out far in the periphery. In this little section here, I have all of these, which are little tips for the tonometer, the tonopin. So to check people's eye pressure, there's a special little tool that taps on the front of their eye and registers the pressure. There's a normal pressure inside the eye, just like on the inside of a basketball, and this goes on the end to keep it clean for each patient. It's a little tiny condom tip for the tonometer pin. And then in this pocket, I have some stuff that I can't tell you guys everything that's in there, because some of it I'm not supposed to have, but I do because it's helpful for me on call. And so I won't show you that, but I'll show you most of it. So in this pocket I keep needles, sterile needles for things like removing metallic corneal foreign bodies. Actually, so these people are like metal grinding, and a piece of metal flies up and gets stuck in their cornea, which happens not infrequently. We'll actually use a needle to pop it out. I have 18 gauge needles, 25, and 30 gauge needles. So we can just take a needle like this and actually use it to kind of get under the piece of metal and pop it out. So it works really well. You should be careful that they don't move when you're doing that. This is something called a Fox shield. All it is a little metal shield to put over people's eyes that come in with a suspected or confirmed like ruptured globe, which is essentially just when someone has trauma to the eye and the eye is now open to the outside world. We put this over their eye and we tape it. We just put a piece of tape across it. That way they can't poke themselves in the eye or nothing hits their eye until we get them to the OR. And that prevents expulsing the internal contents of the eye further from any further like pressure on the eye or trauma. So that's a Fox shield. Next thing I'll show you in that pocket there are these, which are calcium alginate swabs. These are culturing the cornea. So when these people come in with corneal ulcers, what I'll do is take a scalpel blade, anesthetize their cornea with Proparacane, and then use the scalpel blade to scrape the front of the cornea, which is probably freaking some of you out right now, but that's what we do. And then I'll actually gram stain, put it on a slide for gram stain. And it's cool because I majored in microbiology in college, and we actually do all the plating and the smears ourselves. So we don't just culture it and we don't just like touch it with the Q-tip and send it to the lab. We actually plate it on the auger plates ourselves. After I scrape it with the scalpel, I'll take one of these, which is a calcium alginate Q-tip swab, dip it in thioglycolate broth, and then touch it to the cornea and rub it on the area of infection. And then I will take that and plate it onto a blood auger plate, a chocolate auger plate, and a Sabrode's auger plate for aerobic, anaerobic, and fungal growth. So that's helpful to have for corneal ulcers on call. I don't know why this is in there, but it's an irrigation cannula. I have more needles, contact lens case for patients that come in with contact lenses that we need to, or just for them to put it in. Hemostats. I don't know why these are in here necessarily. These are easy to find in the ER, but I have them. I guess you could use these if you're going to do a lateral canthotomy. So a patient has like blood that's building up in their eye socket behind their eye. That can cause a compartment syndrome and compress the nerve. And so you actually have to take scissors and put them in the corner of the eyelid and cut and then cut the tendon that goes from the side of the eye to the essentially the orbital rim here, and to release that blood. And you can use the hemostats to get a hemostasis before you make that cut on the skin there. So that's one of the few true ophthalmologic emergencies. So might have been why I put those in there. And then I have all these 3cc syringes, which I can do an AC paracentesis with, which we did in the last video for the patient with neovascular glaucoma, who went to no light perception after the Avastin injection. If I need to like actually put a needle on this, what I'll do is put a 30 gauge needle on, pull the plunger out. So now when I put it in the eye, it lets that excess pressure flow freely and reduce the pressure in the eye. I have this, which is glue. It's histocryl glue, which if there's like a small corneal perforation that we need to seal, you can actually put this on the cornea and seal it. It's like super glue essentially, but medical super glue for the eye. This is a pH paper that I'll use for when patients get some sort of chemical injury to the eye. They either spill an acid or a base. I can use this to test the pH of the eye and then measure it after we've irrigated to see if it's neutral. Which is what we're going for. Measuring tape, if I need to measure eyelid, like laceration size or something. I don't use that very frequently. And then I have betadine solution, which is 5% as opposed to the 10% that goes on the skin. This is made for the eye. So it's actually put this cleaning solution in the eye before doing procedures in the eye to essentially sterilize the surface of the eye. And then I have a bandage contact lens. I have to be very careful about putting these in patients at the county hospital that are unlikely to follow up. But occasionally I'll need a bandage contact lens for like an inpatient or something. Sometimes they can be hard to find. And then one thing that I have that nobody else carries, but I do because they're super helpful, is when the ER doctors consult saying they can't open a patient's eye. These are Damar retractors. If you're an ophthalmologist, you know that these are used in the OR. But what it is just a hook. So if a patient has like a swollen eyelid, it's just like super edematous and actually like swollen shut, we can take these and actually go up under the eyelid. I'll go under the upper, I'll go under the lower, and I'll pull it apart so I can examine the eye, and I'll have a nurse hold these in position while I examine the eye. So these Damar retractors are super helpful, and you can actually find those on Amazon for not very much. And then I have a marking pen if I need to like mark a patient's side that we're going to take to the OR for like an open globe. And then in this pocket, what I have is a fanny pack, because ophthalmologists wear fanny packs, and there's no shame in that. I have this one, and what I have inside, I can't tell you because it's a secret, but I will show you what's in the front pocket. Lissamine green strips, which I can use in clinic to stain the eye, and then these are fluorescein strips, which I'll use for checking like Seidel signs. So if I think a patient has like an injury to the eye and it's still leaking and ruptured, I can actually use this to tell me if there is a leak there. Other thing that I have, it's the case to my camera lens. So right now I have the camera lens on the camera here, but I'll take it off. So as you saw, it was a wide angle view, and now it's not wide angle because I took it off. But so this is a camera lens that I keep with me, and we can use it for shooting YouTube videos with the wide angle lens, and then I can just screw that off like that, and now it becomes a macro lens. So what this is good for is I can just put it on my phone, and then if I need to take a picture of a patient's cornea super up close, it gets a lot of fine detail, so I can just hold that up to the eye and then get a good picture for their chart so that we can monitor progression and document change over time of like a corneal ulcer or any lesion on the patient's eye. Then I can document any lesion on the patient's eye that we need to track and follow. And that, guys, is basically everything that goes in this call bag. It's super compact, it's super efficient. A lot of the new first-year residents are getting these camera bags just because it's super convenient. And even if you're not in the medical field, if you're not trying to make a call bag, if you just need a bag for your every day-to-day life, this is super nice because of the way it's compartmentalized and it folds open. You can just have access to everything. But if you're super OCD and you like things super organized, get one of these camera bags. This one specifically, it's by a brand called Lowepro. I just got it at Target. It was like $60-something. The smaller version of it, this one, I think was like 40-something, but same brand, Lowepro brand. But I love that. That's my call bag. That's everything I keep in it. Oh, and then one other thing I do keep is this little light. It's a blue light. It's like a cobalt blue light. If I need to put fluorescein in the eye, fluorescein is a molecule that fluoresces under blue light. And so it shows me like corneal abrasions and defects in the epithelium. So that's super helpful. That is everything in the call bag. So I hope that was helpful. If you are an ophthalmology resident and you're trying to make a call bag, maybe try out the camera bag. Alright, I hope you guys liked the video. I'm Zach with Dr. Eyeball MD. Leave a comment down below about a video you'd like to see, and I'll be coming out with more videos. I'll see you guys in the next one.